In the last video, we walked through the 5-step conversation framework. Step 3 was identify needs, and I mentioned 3 specific questions that drive every Medicare decision. Those 3 questions are so important that they deserve their own training. If you memorize nothing else from this entire track, memorize these. They are the foundation of every recommendation you'll ever make. Question 1. What doctors do you see, and what hospitals or health systems do you use? This question tells you whether network matters. If a client sees 3 specialists at a major hospital system, you need to make sure any plan you recommend includes that system in its network. If the plan doesn't, it doesn't matter how good the premiums are or how many extra benefits it offers. The client can't use it the way they need to. On the other hand, if a client only sees a primary care doctor once a year for a checkup, network flexibility may be less of a priority, and they may have more options. Let the answer guide you. Don't assume. Ask and then verify the providers are in network before you make a recommendation. Question 2. What prescriptions do you take? Drug coverage is one of the biggest factors in plan selection, and it's the one most likely to surprise a client if you get it wrong. Every Part D plan and every Medicare Advantage plan with drug coverage has its own formulary. That means a medication covered at a low cost on one plan could be a high-tier specialty drug on another, or not covered at all. You need the client's full medication list, including dosages. Then you run those medications through the plan's formulary tool to see what their actual cost would be on each plan you're considering. A $20 a month difference in premium means nothing if one plan charges $400 more per year for their prescriptions. This question protects the client from a bad surprise, and it protects you from a phone call 3 months later asking why their medications cost so much. Question 3. What's your comfort level with monthly premium versus out-of-pocket cost when you use services? This is the question that helps the client understand the real trade-off between Medicare Supplement and Medicare Advantage, and between different plan tiers within each. Some clients want to pay more each month, so they never have to worry about a surprise bill. Those clients often lean toward a Medicare Supplement plan, where the premium is higher, but the out-of-pocket exposure when they actually use services is minimal. Other clients are healthy, rarely go to the doctor, and would rather keep their monthly cost as low as possible, accepting that they'll pay more if something happens. Those clients may be a fit for a Medicare Advantage plan with a lower or $0 premium, but higher copays and coinsurance when they use care. Neither answer is wrong. Your job is to understand their preference and match it to the right plan structure. Here's why these 3 questions matter so much. Everything else in a Medicare conversation is secondary. Benefits like dental, vision, hearing, gym memberships, those are nice to have. But the 3 things that determine whether a plan actually works for a client day to day are whether their doctors are covered, whether their medications are affordable, and whether the cost structure matches how they think about money. If you get those 3 right, the client is well served. If you get any of them wrong, it doesn't matter what extras the plan includes. One more thing. Ask these questions every time, even when you think you already know the answer. A client you helped last year may have new medications this year. They may have switched doctors. Their financial situation may have changed. Never assume the answer is the same as last time. The 3 questions reset the conversation and make sure your recommendation is based on where the client is right now, not where they were 12 months ago. Your action step is to practice asking these 3 questions out loud until they feel natural. Doctors and hospitals, prescriptions and dosages, monthly cost versus out-of-pocket cost. If you can ask all 3 within the first 5 minutes of an appointment without it feeling like an interrogation, you're in control of the conversation, and you'll make better recommendations every single time.